Hello, I'm Kristen Webb. I'm the Vice President and Chief Nursing Officer for DRH Health. And today I want to take a few minutes to talk to you about face masks. Why should you wear a face mask? Well, as you've heard, the COVID-19 virus transmits or infects us through droplets. Droplets are the normal things that come out of your mouth and your nose when you're coughing, sneezing, or even just talking. The difference between a contaminant that's in the air and a droplet is the droplet will get out into the air, but eventually it will drop. It'll drop to a surface, whereas a contaminant in the air stays in the air. Droplets might enter the mouth, nose, or eyes when you're in close proximity with an individual. They don't stay in the air for a long time, but they can be breathed in. You can also get this transmission, this infection, by touching a surface that's been contaminated and then touching your mouth, nose, or eyes with that contaminant on your hands. On April 3rd, the CDC came out with a recommendation that individuals should be wearing face masks when they're in public. As you know, there had been some controversy about that because you've heard in the news about healthcare providers and first responders having a difficult time finding masks for them to wear to protect themselves while they take care of the patients with known or suspected COVID infections. But the masks that the CDC recommend are different. They're cloth masks is what they're recommending us wear in public, whereas a healthcare provider is wearing an N95 respirator mask. This mask is specific to filtering out 95% of the contaminants. And for a person a doctor or nurse or a first responder who's providing care to patients over an extended period of time during the day or during certain procedures, this is an important mask for them. For us, in the general public, a simple mask that's made of cloth works just fine. The CDC has on their website instructions for when to wear your mask and how to wear your mask, and even instructions for how to make a mask. The mask should have either ear loops, like this one, or ties that can tie around your head. Ideally, it should fit around your face fairly securely, not gapping too much on the sides. Now, as I put it on by the loops, and I adjusted it by the top and the bottom. I avoided touching the center of the mask with my hands. The reason you want to avoid that is you might have contaminant on your hands and now you contaminate your mask, or if you've been wearing this mask for a while and you take it off, you might have a contaminant on the mask and you don't want to get that on your hands. Now, if you're not a sewer like me, I'm not a sewer either, or if you don't have a friend who sews, there are instructions on the CDC website of how to fashion a mask or make a mask without much talent needed at all. One of the instructions talks about just cutting off the bottom of a t-shirt, and so if you have a pair of scissors and an old t-shirt, you can make yourself a pretty good face mask. Another one of the instructions talks about taking a bandana, like this one that I've cut in half, folding it up, take these ponytail holders or these elastic headbands, put one on each end, fold it into the middle, and voila, you've got a little bit of a face protection that's pretty easy to make. So when should you wear a face mask? Well, anytime you're going out in public, it's a great idea to put that face mask on. Ideally, to maintain that droplet transmission range, you want to stay 6 feet away from another individual. But you know, when you're going to the store, to the pharmacy, to the grocery store, you interact with the cashier, you may interact with other individuals. It's very difficult to maintain 6 feet away from someone at all times. So wearing the face mask gives you added protection from those individuals, as well as protects those individuals that you're encountering, your friends and neighbors, from any viruses or illness that you may have. We hear in the news about people who did not have symptoms of the illness, yet they tested positive, or maybe they were infected with the virus for a couple of days before they had those symptoms. So sometimes we just don't know what's growing in our bodies, and if we can protect each other and ourselves at the same time, we need to do that. So who shouldn't wear a face mask? Ideally, a child 2 years old or younger should not be wearing a face mask. They can't breathe well through them, and it can be a little bit more dangerous to them. Or any individual who would be unable to remove that face mask themselves if they had to in a hurry. How do you take care of the face mask? These cloth face masks are ideal because they can be washed with your normal laundry. Ideally, you want to wash them in your washing machine, dry them in your dryer, particularly if you wore it for a prolonged period of time. Now, if you've just wore it for a very short amount of time, you might choose to store it carefully and rewear it without washing, or if you wore it for a few hours and you're not ready to do a load of laundry, you could hand wash it in the sink and let it air dry overnight. But ideally, you want to wash them at least in the machine and dry them fairly frequently, especially depending on how long you've worn them. So stay safe, stay home when you can, and when you can't and you have to get out in public, wear your face mask to protect your friends, your neighbors, and yourself. Thank you.